Welcome to this week's NIB News Update.
The National Prescription Drug Plan's Phase 2 is now underway, with our country's armed forces and civil servants as the newest beneficiaries. NIB Director Algernon Cargill tells us about the public's response to the drug plan so far.
Response from the public has been very, very positive. We continue to receive a lot of response that's been positive, as I said. One of the concerns that was initially expressed was the fact that the board had a mix of generic as well as brand drugs. And what we've done is that we've ensured that the generic drugs we provide under the plan, these are drugs that are already in circulation within the Bahamas. These are the drugs that are commonly prescribed, and these are drugs that some patients who actually were paying for themselves, they would actually opt to receive the generic drugs instead of brand drugs. But the generic drugs under the plan, these are drugs that have been thoroughly tested, not just in the Bahamas, but regionally, as well as internationally. And the brand drugs, of course, are the accepted drugs that everyone knows. And we're very happy with the overall scope of the plan in that we have over 160 drugs and medical supplies. For example, if someone has diabetes, we actually provide them with the machine in order to read their diabetes test on a daily basis. If a child has asthma, they provide with a nebulizer. And these are benefits that were never provided before. So we're happy that we can provide over 160 drugs and medical supplies to beneficiaries of the plan in order that they can manage their chronic ailment. And before, as we know, we've all heard the stories of people had to wait on long lines in the public clinics, public facilities, etc. They can now visit any private pharmacy who is a participating pharmacy under the plan, and these are all listed on our website, nibdrugplan.com, and they can determine which pharmacy they want to visit, and they can receive their drugs free, in most cases without waiting more than 5 minutes at all.
The drug plan is set to benefit all Bahamians in the long run. Here's more on the future of the drug plan.
Well, the drug plan is an evolving process. The drug plan is really the government's first step at the National Health Insurance Plan. And what we decided to do initially was to launch a drug plan as a first step, as I said. After we've launched this phase that started today, the next step would be to launch a plan to the rest of the Bahamas. And we don't have a date. That's a political decision that we at the board, we would have to accept that date whenever it's announced. But when that is announced, what happens is that the rest of the population can be covered as beneficiaries of the plan. And then there will be a copay where they would pay a copay based on their prescription. And of course, no one wants to have a copay. But what we're then providing is increased medication, a wider distribution point, and a lower cost. And this is what the plan actually stands for: access, choice, and equity.
Apart from the armed forces and civil servants, our country's pregnant women and indigent will also benefit from Phase 2 of the drug plan. Here's Cargill to explain.
In terms of pregnant women, the National Insurance Board is not providing the antenatal drugs for pregnant women. What we provide is if a pregnant woman has one of the 11 ailments, 11 chronic diseases that are covered under the plan, they can receive their medication to treat, for example, diabetes or hypertension free while they're pregnant. And we actually plan to provide pregnant women with their medication free as beneficiaries up to 6 months after delivery. So what we're doing is ensuring that pregnant women can take care of their children, as well as they have a healthy pregnancy that's not affected by any of the chronic ailments that are listed under the drug plan. What we've done is we've partnered with the Department of Social Services to determine who is indigent. And indigent essentially be poor persons who really don't have any source of income in order to provide or in order to purchase their prescription medication. So once you're deemed indigent by the Department of Social Services, the National Insurance Board will essentially accept the recommendation from the Department of Social Services and provide and allow for these persons to be registered as beneficiaries of the plan. And what we expect is the new groups I've mentioned, together with the initial 4 groups that were beneficiaries in the first phase, we plan to have more than 30,000 applicants altogether join the plan.